Hello friends, today we are going to learn how to read a CBCT. As I have already covered how to read IOPA, OPG and in our radiology learning series, now we are proceed for how to read CBCT part 1 video. Today we are going to cover introduction and basic advantages and indication part. Myself, Dr. Hemant Bhavnerkar. I'm a Mumbai based oral maxillofacial surgeon. Let us start. Today's session I am starting with one small story. A few years back, one student come to me with such kind of scans. He was a dental graduate student, a observer at my oral surgery center. He always wants to learn CBCT and he always tell me that, sir, whenever I see such a different scan, I was very confused. He was very confused that he was not able to read such a scans. That time I told you that CBCT is a third eye for surgeons, like the thing which cannot seen by the IOPA or OPG or 2D radiology, that hidden part also visible and diagnosable by the CBCT, right? As we already know that CBCT is a cone beam computerized tomography. What is tomography? Tomography is any sectional study of the human anatomical body, right? So tomography means with the help of radiology we can able to see the particular part of anatomy of human body with the three different directions or three different views. Like here we are seeing the coronal, sagittal and axial sections of the CBCT. This is representative scans. We are going to see which scan is where important and how they are able to help to diagnose the certain pathology or the certain anatomical diagnostic treatment planning part. As we know that CBCT is computerized tomography done by a cone beam system. This is a CBCT machine where patient is have to stand between the two arcs, and when the machine start, this arc is rotated around the head and neck region for the minimum 30 seconds. During that 30 second, radiation scans capture the DICOM data. What is DICOM data? We are going to see in future slides. The data connected by this machine, it sequentialized by the computer software and give the view in three different directions. And the computers also do the 3D reconstruction for the more accuracy view for the treatment planning, right? It is basically 3D radiology. As I said, it is cross sectional display of the study and it is done for more accurate diagnosis of particular area. Let us see when to do a CBCT. As we know, dental cone beam computerized tomography is used when there is a regular two-dimensional dental X-ray is not sufficient. Means here this is the OPG. We already learned how to read OPG, right? Here we can able to see these are the impacted tooth. All four wisdom tooth are impacted. We can able to just diagnose on this OPG that these are impacted, these are inside, but they are present on buccal side, they are present on lingual side, how much approximation from the inferior alveolar nerve canal here, how much approximation here with the sinuses, whether they are present palatally, buccally, the root anatomy, the distance, accurate distance between the sinuses floor or inferior alveolar nerve floor. If in case of fractures, number of fracture cases, in case of implants, the exact width, dimensions, these cannot be found on normal routine radiology. So for more accurate diagnosis, we proceed for the CBCT, right? So what are the indications of the CBCT? The most common indication for CBCT is diagnosis of impacted tooth and its location. Basically, whenever there is impacted tooth, whichever we can say, it's if it's a impacted canine, impacted premolar, or supernumerary tooth, or even a wisdom tooth, if we have to locate exact location of their position inside the jaw, we have to do a CBCT. So we can able to diagnose whether they are placed more buccally, palatally, lingually, or buccally, and we can able to find the exact dimension from the vital structures. In next my video, we will see the all these specific cases and their treatment planning. For learning detailed CBCT and treatment planning and their indications, kindly subscribe my YouTube channel Oral Surgery and Beyond, and like, share and subscribe, and also tell to your friends to join my YouTube channel. Right? The next indication is fracture of the jaw bones. So we can able to see how many jaw fractures at present, how the fracture line is passing, right? Implant planning, the most common and most widely used CBCTs nowadays is for the implant planning. Here we can able to see that here we have to place a implant. So how much is the width, how much is the height, this can be easily measured with the help of CBCT. These are the axial section and coronal section and sagittal sections, right? Then for bone pathology, soft tissue pathology like radicular cyst, ameloblastoma, dentigerous cyst, odontogenic keratocyst, or facial asymmetries, the bony growth, fibromas, these we can able to see exact extent, exact dimensions of the pathology. Then before orthognathic surgery, we also advise CBCT for the patient. TMJ, most useful in TMJ cases, like we have to diagnose arthritis, TMJ ankylosis, right? The more accurate dimensions of the ankylosis part we can able to see in CBCT. In my subsequent videos on CBCT, we can able to see all these cases. The use of CBCT in endodontics and orthodontics is also important nowadays. Let's see how the CBCT system works. Here, this is a machine where patient is standing between the machine walk, and after the machine start, the X-ray source starts X-ray radiation to one direction to the opposite direction, where the sensor is capturing the images and converted all the images data in DICOM form and save inside the computer. The advantages of CBCT: As we know, CBCT is a have a rapid scan time. It has minimum or little radiation exposure. Then image accuracy is highest in all form of the radiology. Reduction in patient radiation does when compared to the other medical CT scans. So it's better to always advise the CBCT scans for head and neck if available than normal computerized CT scans. Then interactive display modes are available, like when you are doing scans, then that time you are able to see exact scans formation, 3D reconstruction scans and the computer. The multiplanar reforming is also available. Three-dimensional volume rendering, 3D reconstructions are possible due to new computerized software. Better images quality, better visualization, and ultimately better diagnosis is possible. Then let's see what is the DICOM data and what are the different sections of the CBCT. Here, when the scans are taken, all the scans are converted into DICOM data. What is DICOM? It's a digital imaging and communication in medicine scan format, right? Actually, the axial section is not a true scan section. Actual sections are sagittal and coronal sections. Then, with the help of sagittal and coronal section, computer is from axial section, and with the help of axial, coronal, and sagittal sections, computer from 3D reconstructed model, 3D reconstruction images. So that's why it's always said that sagittal and coronal sections are the true sections, and the other sections are reconstructed sections. Here we can able to see on face such a sections of vertical sections in midline is called a sagittal section. This is a sagittal section. A parallel to the coronal suture section taken in head and neck is called a coronal section. Here this is the coronal section, and axis and axial section. This is the axial section of mandible. Here the pathology we can able to see. We will see the diagnosis part in later slides. Image formation, as I already said that the whenever there is a DICOM data collected by computer and the software of on the computer, they form the accurate images from the 2D images to convert into 3D images and form the sagittal, coronal, axial and the three constructed images. So whenever now onwards we talk on the scans, we will talk these terms coronal, axial and sagittal sections of the mandible or maxilla or sinuses or head and neck bone. One point to be noted before proceeding that there is a field of view concept. We will see all the fundamental terms in my next video on CBCT, but I find this is important to introduce earlier that field of view. Whenever you advise patient to go for a particular area of CBCT, so that technician always asks to the doctor which FOV is required. Right? The FOV is a field of view. Means how much field you have to read or you have to scan for the diagnosis of the certain thing, right? Here most is 15 by 15 is a most largest wider FOV we can take by CPCT. Here 12 by 8, 6 by 8 centimeter and 6 by 6 centimeter. 6 by 6 centimeter FOV is used for the block sectional implant planning cases, and full scans is taken for the multiple jaw fractures, right? The advantage of accurate identification of FOV is for the reduced radiation exposure and more attention provided by the scans to the CBCT software. So this is the field of view part of the CBCT. Let's see how the CBCT works in different pathology and for the clinical implications. Actually, CBCT, I always said that it is a third eye in dental implants. Actually, what is a third eye, right? The third eye shows us that which we cannot see with the our two eyes, right? Whenever we do the diagnosis on clinical diagnosis, clinical examination, or the 2D X-ray diagnosis, we can able to see a superficial part, but at deep part we required a third eye, right? So with CBCT we can able to see inside structure of the bone or soft tissue. Here CBCT reconstruction planning is done on a CBCT software. We will see in next video how to do a 3D CBCT planning for the implant placement in mandible jaw. So kindly subscribe my YouTube channel Oral Surgery and Beyond. Let us start few cases. Right. Here we can able to see this is a impacted canine. Right. This is very close to the floor of sinus and it is completely horizontal just below the roots of the premolars. So on 2D radiology we can able to see only this much part. Right, on CBCT here in axial section of maxilla we can able to see the crown is more toward buccal cortical plate and the root is more toward palatal side. Here in sagittal section we can able to see that the crown may have a very little bone coverage than palatal part, right? So we can able to plan a surgery, we can start osteotomy here. So like this we can plan the surgery. These are the 3D reconstruction model. Here we can able to see there is a less bone cover here. So after whenever we take the flap here, expose the gums, we do the corticotomy here. We remove the buccal cortical plate here where it may be a eggshell like bone only. Then we section the crown here. We take out the crown and then we take out the roots. We can able to see that root is more toward palatal on premolars. So how it's helpful? This is a case of trauma 10 years back and ultimately develops a cyst. Here we can able to see that the cyst dimension is almost 22.4 millimeter laterally and vertically or 12.5 millimeter. We can able to see the midline extension also on the other scans. This is a 3D reconstruction of all the three scans. So anterior view is showing that this much portion is resolved and the nasal floor is also involved. So these 3D reconstruction models are also helpful to educate the patient and show the actual visualization of the pathology of extent. So I always insist to do a CBCT scans in my all pathology cases. Here patient is going undergone orthodontic treatment and having a two impacted canines. Here we can able to see the position of the canine is very deep. On axial section we can able to see the buccal bone is very thin, so orthodontist can plan whether they can able to retract on their normal position and how much time it will take, so they can identify the how much bone is covered and how much bone resistance they may get. If they require to go for surgery, they can advise. Here we can able to see tooth is more palatal compared to the buccal side. Here the CBCT of the fracture of the mandible, right? In anterior view we can able to see is fracture line is passing on the parasymphysis region, and the inferior border of mandible is also breached. Here on axial sections, the we can able to see the both the cortex, buccal and lingual cortex, both are fractured. The fracture line is starting from midline and going posterior up to the inferior border of mandible. So this is a direct indication of open reduction and internal fixation. Right? This is a view from the lingual side. This is a view from the downside. Or we can able to see a worm's eye view. These all three are 3D reconstructed images. One more CBCT scan for the posterior mandible pathology. We can able to see that this is a impacted wisdom tooth, and the pathology we can able to see that it starts from the impacted wisdom tooth, or this maybe starts from the these infected molars. So this may be chance of this may be a mixed pathology also, a radicular cyst or lentigerous cyst both. There is a now on the axial, coronal and sagittal reconstruction we can able to get these images, but we have to see the lateral expansion, right? Whether the pathology is having a lateral expansion or not. So we are going to go for coronal section check. Here we can able to see that there is a not much coronal or buccal or lingual cortical expansion. If there is a chances of ameloblastoma, there is a high chances of buccal cortical expansion, right? We can able to see here a very minimal cortical expansion. So radiologically, we can rule out the unicystic ameloblastoma here, but we will put the unicystic ameloblastoma in differential diagnosis. Here we can able to see these red points. This is inferior alveolar nerve. Now tracing is, this is a red is inferior alveolar nerve and now tracing pathology and its approximation. So we can able to see that the canal bundle is almost inside the pathology, and patient is having a slight paresthesia over this region, right? So in such a cases we can exactly find the dimensions, is extends, its vital structure approximation, its involvement and treatment planning. CBCT is also helpful for identification accessory canals before endodontic treatment. In RCT cases, sometimes we find that we are not getting a good results. Patient is having some symptoms after the RCT also. So for such cases, sometimes dental surgeons advise for the identification of accessory canals. Here the accessory canals present almost 2.8 millimeter on buccal to lateral side. Here you can able to see the MB1 and MB2 canals are present, and MB2 canal is not obturated. So for such a minute detailing, it's also helpful in endodontic cases. Most important application is on implant planning, right? As we identified the bone available on the other scans, we can able to do a splint formation. Splint, here the splint is made with the help of CBCT scans. CBCT is done, DICOM data is sent to the dental labs, and with the help of that the DICOM data, they have made such a splint. So just dental surgeon need to place this splint and place the implant at desired level. What we do actually on implant planning, that we identify the height of the bone, width of the bone, and the distance from the vital structure from the alveolar crest. So in this available bone, we can able to see which size implant can be placed, right? So for that we have to see all the axial, coronal and sagittal sections, and we have to identify the exact implant selection for the particular case, right? We will see in detail an actual software workout in my subsequent next CBCT cases. So today we have covered basic introduction, scan patterns, basic terminology, and advantages and indication of CBCT. In my next CBCT video, I will cover a fundamental terms and CBCT reading in on actual cases and treatment planning. Thank you for patient listening today. For more free learning oral surgery topics, subscribe, like and share my oral surgery and beyond YouTube channels. Tell your friends also to join and help me to spread oral surgery awareness. Myself, Dr. Hemant Bhavnerkar from Mumbai. Thank you. Thank you for today.